Uunspire Alliance is a network of youth and young professionals working in science, engineering, technology, and innovation.
Uunspire Alliance provides the platform for youth and young professionals to connect, engage, and learn from other youth and experts in the region.
We are not only at the international conferences or at the laboratories. Uunspire is working together with the local community in the field
to participate in decision making, demonstrating their ability for advocacy, communication, and consultation, as well as leveraging advanced technology.
We strongly believe that inclusivity is the integral factor of the DRR. Hence, all our work and projects are people-centric and from the communities on the ground.
We are committed to supporting youth leadership. We are happy to work with the Uunspire Alliance.
Uunspire Alliance bridges the gap between professionals and young specialists and make it possible to exchange knowledge and experience between Asian countries to make them more resilient.
We work with youth and the young professionals from the academe and the industry sectors to build back better in a post-pandemic world.
Uunspire has connected us and bring us together to contribute for disaster risk reduction and climate change by utilizing science, engineering, technology, and innovation.
Hello and welcome everyone to Chocolate Talk on DRR, chapter number 8, where the topic today will be on human-induced disasters. This will be our first webinar for the year 2022. I hope it is still not too late to wish everyone to have a blessed new year. My name is Norzaihan from Uunspire Malaysia and I will be your moderator for today's Chocolate Talk session. As everybody knows, there is no natural disasters. All we have is natural hazard and human-induced disasters. Natural hazards are large-scale geological or meteorological events that have the potential to cause loss of life or property, meaning say it was predominantly associated with natural process and phenomena. And the frequency of the disaster was increasing due to the recent climate changes. While human-induced hazard or anthropogenic hazard was entirely induced by human activities and choices. Surprisingly, in this period where humans are racing to become developed countries, unknowingly their actions have caused the increase of human-induced hazard and the impact becomes worsened with the recent climate changes. So today we bring to you the three wonderful speakers to talk about the impact and the consequences of human-induced disasters on our population and environment. Moving forward, I would like to introduce our first speaker for today, Dr. Sreeja M U. She is currently working as a hazard analyst with Kerala State Disaster Management Authority since 2018, also a member of CRRP India. She also used to work in disaster management unit with the government of Maharashtra from 2016 to 2018. She received her Master of Science in Disaster Management from Tata Institute of Social Science, Mumbai, and also volunteered during the Nepal earthquake in 2015. And today, her session topic will be a case study of COVID-19 disaster in Kerala, India. To Dr. Sreeja, the screen is yours.
Thank you, Anne. I'm sharing my. I hope you can see the presentation.
Yes, perfect, Doctor.
Yeah, thank you, Anne. And also good day to all of you. I would like to talk about the topic COVID-19, which is considered as a disaster in the context of as a case study from Kerala, where I'm working as a hazard analyst for the last 4 years. So we all are disaster management professionals, and we know there are no natural disasters, but rather there are natural hazards, which she has already, the moderator has already mentioned about it. So I don't want to go deep into it. But yeah, this one definition I'm saying because it is from UNISDR, which shows the importance of exposure and vulnerability for a disaster to occur. The definition says that a disaster is a serious disruption to the functioning of a society or a community at any scale due to a hazardous event interacting with conditions of exposure, vulnerability, and capacity, leading to one or more of the following, that is human, material, economic, and environmental losses and impact. Usually when we talk about natural hazards or disasters, we always talk about the major hazard or the event which happened, but we talk less about the exposure and the vulnerability involved in it, which makes the hazards into a disaster. So going into it, again, this is something which we all are aware about, but still I'm rushing through it because it will give an introduction to it. That is, the things which make a natural hazard into human-induced are social and economic inequalities. We all know about it. Inadequate early warning dissemination system. Definitely, all the countries in the world, almost all the countries in the world, have a very good early warning system in place where they can predict cyclones and tsunamis quite early. But the problem is with the dissemination system, where the last mile connectivity is not happening, and due to which most of the time these natural hazards turn into human-induced disasters. Definitely, there are lack of policies, and or even if there are proper policies, it may not be able to address the vulnerability aspect of disasters. So that also contributes to it. Inadequate and inappropriate urban planning. I know there are too many things. I have listed out just a few elements. Inadequate and improper planning. Definitely, we all are aware that the increase in recent urban flooding and other disasters happening in urban spaces are due to the improper planning and definitely due to the rapid urbanization, and along with that there is no proper planning for this urban planning and inadequate DRR activities. Even in this 2022, we are still talking about disaster management as if it is something like a disaster response or disaster relief, which is not the case. We have to start talking about disasters and development, and which will help to understand the human-induced disasters in a better way. In this segment, I'm not talking about the climate change or other aspects, because I'm sure you all are well aware about how climate change contributes to natural increase in the natural hazards, the events, their intensity, and all, which I'm not going to discuss much about much in this session. So coming to my major topic, that is the pandemic, COVID-19. I know COVID-19 doesn't need any introduction, but still I'm rushing through it through the how it happened. In 31st December 2019, WHO Beijing office received this information about the new virus. In 13 January, the first overseas case was identified or reported. In 30th January, It's a day in which the COVID-19 was declared as a public health emergency of international concern, and on the same day, the first COVID case was reported in India. That particular case was reported in Kerala state, which the cases were from three students who were studying in China, who came back during the pandemic time. Not at that time it was not declared as a pandemic. At that time it was still a concern, public health concern that time. So the first case was reported on 30th January 2020. And in 11th March, the COVID-19 was declared as a global pandemic. And in 23rd March itself, Kerala went into a lockdown, and in 25th March, the whole country, India, went into a lockdown. The things and in August, March, and January, in 3 years, the first, second, and third wave of COVID happened, which is currently in ongoing process. So I would like to just give a brief about the state where I am working, that is Kerala, which is in the southernmost part of India. You can see the map of India where you can see where Kerala is located. It is a very tiny piece of land that is just taking a 1.18% share of the whole land mass of India, but takes a 2.76% of population of this country. The population density is quite high in Kerala, that is 890 people are living per square kilometer, and the population is around 34 million. So 2015, this state is considered as one of the most developed state in the context of Human Development Index, not just the economic growth. I'm not talking about the economic growth, but rather about the literacy rate and about the health system. It got a very good Human Development Index also. But the same state is also prone to highest number of cases of diabetes or hypertension, cardiovascular diseases, and other lifestyle disorders. I'm showing the graph of the COVID-19 wave it happened in India, where you can see the 3 weeks separately, which happened in 3 different years, and how the cases increased. And here the same COVID-19 cases in Kerala, state of Kerala, where you can see the 3 different waves happening. One thing the Kerala government was focused, or the Kerala Public Health Department and the Health Department was focused, was to push the peak of the wave to the maximum extent, so that we can prepare better for the patients and treat them properly. So we were trying to push it. So the peak was delayed for up to 2 months in almost all the cases except for the third wave. Otherwise, even though the peak of the wave was happening in March or in August in case of whole India, the peak happened in October in case of Kerala. So we were pushing the peak of the wave. That's one thing which we were focused in. So coming to hazards, we all know COVID-19 is a biological hazard or biological disaster. Definitely a pandemic, it becomes in itself as a disaster, because not the sheer number, not only because of the sheer number, definitely that is one thing, but rather it disrupts the whole healthcare system, not only the healthcare system, but the whole society. It disrupts the functioning of the society and the community. So that could be considered as a hazard. But more than that, the secondary hazard, that is the lockdown which happened all across the world and also in Kerala, that would be considered as a hazard itself, because of the large number of population suffered due to loss of livelihood, loss of without proper income, without proper food and basic necessities. So that would be considered as a secondary hazard, and there were cascading hazards or multiple hazards. During the time of COVID-19 itself, while managing the COVID-19, there were multiple hazards happening in Kerala, such as Tauti cyclone was happening, there were regular monsoon, seasonal monsoon, and its flood was happening, and there were multiple epidemics were happening during the period of COVID-19 management. So these three hazards were happening simultaneously. Coming to the vulnerable population, I'm talking about the Kerala aspect of it. I'm not talking about the whole India. I would like to, since it is a medical disaster, a biological disaster, I would like to show it as a medical aspect and non-medical aspect of the vulnerability of the population. In Kerala is a state in which there are large number of comorbidities were existing. You all know what is a comorbidity is. The people will be having multiple other disorders like AIDS or autoimmune disease or cancer for that matter. In Kerala, the number of cases of cancer was so high that is in 1 million population, around 1,800 people were detected with cancer. And every year, more than 35,000 people are detected with cancer every year. So that was very much prevalent in the Kerala community and increased the vulnerability and the medical aspect because most of the vulnerable people were those who were having comorbidities. Elderly population size, that is one aspect. In Kerala, around 4 million people, the elderly population above 65 years of age, that was also a vulnerable aspect. And the lifestyle disorders like obesity or hypertension and diabetes, around 40% of the population are obese or which put the people at higher risk. And non-medical aspects definitely, at least with such a high density of population, makes the physical vulnerability of the community towards COVID-19. Definitely, we know COVID-19 spreads in congested areas, so especially in places like slums, the cases were increasing a lot. Accessibility to healthcare. Kerala is a state in which both the urban and the rural areas was having sufficient, are having even now proper healthcare system. But even then, due to lockdown, there were problems with transportation. They were not getting sufficient vehicles to go to the hospitals. The doctors and other healthcare workers were focused on COVID management rather than managing other disorders, other lifestyle disorders or other non-communicable, communicable disorders. That was one aspect. Accessibility to clean water, which was also a concern because we were talking about washing hands with soap, and that was a way of prevention, which was also a problem because COVID peaked for the first time during the month of March, April, May, which was the summer season, and that is a big time in which there was scarcity of drinking water and normal other clean water also. And other communities were also at risk, especially the migrant workers who migrated from the rural places of other states, migrated to Kerala for work. These communities were stranded in that not just happened in Kerala, but all across India, the same scenario happened. And in Kerala, there were more than 5 million people, migrant workers in Kerala. Most of them lost their livelihood and no one was there to take care of them. They cannot go back. So that situation was there. And another community which was more vulnerable was the tribal community, just like in any part of India, of the world. Always one of the major vulnerable communities, the tribal population, was also at risk because most of them were living in remote locations and accessibility to basic supplies, medicine, and all was difficult, especially during the lockdown period. I'm not doing much detail simply because of the shortage of time. Yeah, these are challenges because I was working with the disaster management authority. These were the challenges which we faced during the COVID time. That is needs for elderly during lockdown. Elderly were considered as the most vulnerable people during COVID, and in addition to the COVID, they were having other disorders and they need medicines, food, and all. Their needs had to be addressed separately. For that, we tried to open different control rooms and all, but most of them were not able to use these facilities. So such challenges we faced. basic food and other basic food necessities for people. During lockdown, that was announced all on a sudden, and people could not prepare for it. It was a new thing. Lockdown was a very new thing for the people, and they were not ready for that. They were not having sufficient savings to carry out their basic life necessities. So that one thing was there. Then the burnout of healthcare workers. After facing the COVID for around 6 months continuously due to the tremendous work, the COVID, the healthcare workers were in burnout, and most of them they were infected with COVID. They were not able to find properly, give them proper leave or give them proper rest. That thing was lacking. And other challenges which we face is one is language barrier, especially with the migrant communities. The migrant communities, even when we try to communicate with them, they were not having basic the knowledge about the local language here, and that acts as a barrier. And also the stigma associated with COVID. While other hazards were happening when we had to go for rescue work and relief work, there was always a stigma that whether this person is infected with COVID, such stigma was always there, and it felt as a challenge for us. And also there was continuous changes in the guidelines and all, which also contributed to the already existing confusions in our society. So, coming to the role of youth and young professionals, during all these challenges, one thing which we felt that which helped us a lot is the volunteers which were coming actively into our control room and our disaster management authority. They were so ready to willing to help the community, and with their help, we could manage the pandemic better in a better way. The door-to-door supply, especially for the vulnerable population and elderly, we introduced the concept of basic home delivery of the basic necessities, and for that we opened an application, mobile application named Door-to-Door. That is a mobile application which we developed, in which the people could open the app, they could understand what are the basic necessities they want, whether they need medicines, whether they need to buy facial meat, the major important contact numbers, ambulance, or if they are not able to prepare the food in their home, they can get the support of community kitchen. So these things were made available in that application, which was introduced in our state and especially in the district where I'm working. And with the support, people can just write in a piece of paper and just click a picture and send it to us. With the help of this application, it will be delivered. It was delivered at their doorstep with the support of volunteers. In the picture, you can see they're explaining the application to the district collector about the mobile application. So that was one thing which helped to support the elderly population, not the elderly population, or palliative care patients and other vulnerable population. The basic need of mobile phone definitely was there. That was also a challenge during that time. Not everyone was tech savvy, or they may not be able to use mobile phones. For elderly, it could be a difficult thing to keep in. So that was also there. Management of crowd in airport, railway stations, and in every places. It was done with the support of the youth. Volunteers, management of for the management of patients. We had this COVID first line treatment center, second line treatment center, and in the initial phase for quarantine, we had this COVID care centers where people will be isolated, not isolated, but quarantined. They are not patients, but they are exposed to the virus, or they are suspected. We suspect that they are exposed to the virus, and they were kept in quarantine with separate washrooms, and all these COVID centers were managed with the support of the volunteers. And also those patients who need support treatment like dialysis or palliative care, we managed it using these volunteers. Also, multilingual control rooms for guest laborers or migrant laborers were opened because most of the youths, they know how to handle different languages like Hindi or Bengali. They know these multiple languages, and for them, with the support of these youths, we opened multilingual control rooms to support the migrant laborers. And also, the government opted for this one website called COVID Brigade, through which professionals, that is doctors, nurses, and other healthcare professionals, could apply in this volunteering program called COVID Brigade, and that is managed centrally by the state government. And whichever district needs some additional supply of human power, it was supplied through COVID Brigade. And general volunteers were also there. There is a concept of interagency coordination which is there happening in Kerala right now, which started from Kerala Flood 2018. During that time, we opted for something called interagency group, in which it is a platform of NGOs, non-government organizations and other civil society organizations come together to work with the district administration and the state administration, holding hands with the government. So that the government will be able to manage the resources in a more appropriate way with the support of the NGOs. So that was happening in Kerala since 2018, and during COVID time, we could use those volunteers of interagency group for different works. So that way, the youth contributed much towards the management of the pandemic. Yeah, impacts of COVID-19. This one picture, these three pictures which I'm showing is, I'm trying to show the simple example of how it impacted the education sector. The first picture you can see how a tribal community, that is not a picture from Kerala, rather it is a picture from another part of India, named another state named Jharkhand, where children were taught in certain way in the school itself because they were not having enough access to mobile phones or computers or laptops. The second picture I have taken from Kerala context, in which the state government opened a TV channel named Victor's Channel, through which the government shows programs, educational programs, and was broadcasted through television. So the kids could come together in a single house in which there's TV, and they could use it. So that way it was helping children. But in the third picture, you can see kids comfortably at their home using single laptop, and that was also happening to show what a disaster is and how the vulnerability modifies, or how it impacts the community, and how a pandemic would result in disaster, and how it impacts even a simple sector like education sector. And all the other things, I think every one of us are aware how the lockdown has impacted the jobs, how the blue collar still they have the option for work from home, and most of the people were continuing to work, but rather the blue collar jobs, they were mostly affected. They could not get those who were working as plumbers or other normal work. They could not go back to their work because of the lockdown. They never had this option of work from home, and so they were much impacted. Similarly, the small medium scale industry, they were also impacted. I'm not going into detail because it takes too much time to talk about the communicable diseases such as malaria and other diseases, how it impacted on the surveillance, both active and passive surveillance of communicable and non-communicable diseases. It has huge impact, immense impact, and we are still not able to understand how much this impact is going to affect the health of the population, because it's an ongoing disaster. So maybe after a few years, we will be able to understand how much this pandemic impacted the health of people, and definitely it has impacted the mental health of people in a very severe way. That is around 1,000 and around 1,000 something healthcare workers, mental healthcare professionals were there. But even then, they could not manage the incidence of suicides or other abuse. All these things increased after the pandemic. It's not just happening in Kerala, but all across the globe. There is incidents of domestic violence. Definitely, the incidents of domestic violence are increasing, and all other forms of violence. So the support which is needed, definitely, all these things are having long-term impact on the health and even the mental health of the population. And the way forward, the first thing we have to understand, especially, I'm not talking just about the COVID, but rather for any other disaster. First thing is going back to the basics, that is understanding what is disaster risk. We know that is the first priority of Central Framework, going back to the basics and understanding what is risk and what are the elements of risk, understanding what is the vulnerability and how the exposure is going to impact. So going back to that.
Sorry to interrupt for a while. Can I ask you to make it a bit to wrap up these things? The presentations.
Yeah, sure. Thank you. So I would like to summarize it as it's the same thing which we all are aware that we have to go back to the basics, try to understand what is risk, how it could impact, how it makes a hazard, simple hazard, into a disaster. And giving more importance to researches, more importance to discussions with the involvement of youth and their innovative methods. We could understand it much better, and we could try to decrease the impact of such hazards and try to decrease the impact of human induced disasters. So that's all from my part. Thank you.
All right. Thank you, Dr. Sreeja, for a very insightful presentation. I guess everybody can relate to this presentation because we have been experiencing for over 2 years. So I could say the impact is still ongoing. So we leave the things here for a while. So we're moving forward for our second speakers of today. I would like to call Dr. Anisa Triyanti, a member of Uunspire Indonesia. She's a postdoctoral researcher and also a lecturer at Utrecht University. She obtained her Ph.D. on the topic of governance of ecosystem-based disaster risk reduction in 2019 from the University of Amsterdam. She actively participates in various programs and organizations of youth and young scientists, and she is the co-founder of the UN Major Group for Children and Youth, UNMGCY. Today, her presentation will be on governing systemic human-induced disaster. To Dr. Anisa, the screen is yours.
Thank you so much. Can you hear me clearly and see the presentation?
Yes.
Yeah, okay. Great. Thank you, Anne, for the very nice introduction. Maybe a little bit of a disclaimer. I'm not a co-founder of UNMGCY, but a part of the initiatives within the UNMGCY, which is the Young Scientist Platform on Disaster Risk Reduction. There's a lot of history, of course, of my involvement with the young professional and young scientist activities in DRR. But today I rather wanted to use this opportunity to brainstorm with you, to discuss more about human-induced disasters, understanding new concepts and terminologies, and especially how to implement it on the ground to make sure that it can be translated for disaster risk managers in the future. Like I said, I wanted to make this interactive. So I wanted to invite you guys here in Zoom, but also maybe people who are watching via YouTube. I hope there are people watching also to join the platform called WooClub. Let me check how I can, So if you can all try to type this link, wooclub.com, and use the code here. We are going to use this platform for all session and my presentation time. So just keep it open in your phone or your computer web page. I can see if you guys are already joining via this symbol here. So one joined, which is me, I think. I also joined via my phone. So if you can join in, that will be great. I will just move to the next slide. You can still see the link to join, of course. First, I wanted to know, where are you based? So where are you now in terms of country? I mean, it's very difficult to ask this question, I guess, especially if you ask nationality, where you come from and where you live for a long time, but where are you now exactly? Great, so we see results, 7 people, 8 people, 9 people. From Nepal, Malaysia, India, Indonesia, Kyrgyzstan. Very nice. Let's take a moment again to see if we can see a new country pop up. Still the same. Well, but this is already very nice to see diversity of countries, of course. Maybe 30 seconds more. Okay, seems like this is a dominated countries. Okay, and the next question is, I wanted to know your background. So I believe that it's a mixture between researchers and also other sectors. You work in a governmental agency or NGOs. You can just choose whichever represent you the most, let's say. I also put there science broker or transdisciplinary agent. That means that you work in all of the sectors and trying to bridge each other. I hope that answered your questions, Dr. Rahma. If you feel like you're all of this, then just choose science broker or transdisciplinary agent. See, there are 8 people already voted. Social science kind of dominating, very nice. Now interdisciplinary means that you work in both natural and social science. NGO, I believe that Dr. Sreeja is part of the governmental agencies. So that's also checked. Private sectors, no one from private sectors, consultancy. Okay, for the sake of time, I think we just have to move on. So yeah, today I actually wanted to talk more about concepts, and yeah, I try to make it as practical as possible, but I think it's really nice then to follow Dr. Sreeja's presentation, because we started with a very empirical questions and also situations in Kerala and COVID-19 impact. I think the concept of Anthropocene is very, very relevant to our topic today, which is human-induced disaster. This concept is more from the Earth system governance field or climate change, I would say. We don't use that so much for the DRR field, but I think it's a good concept to start with, that we are now entering a new geological epoch called the Anthropocene. Why? Because now humans are dominating our Earth system. We change our Earth, we grow as humans, or rapid population grow, we change the landscape with urbanization, more industrialization activities, land use conversion. We also extract natural resources in a bad way, actually, with the groundwater extraction, for example. We degrade our environment, which then affect the ecosystem, the health and diversity of our ecosystems. And one of the examples, of course, the COVID-19 crisis, which is the result of human encroachment to environment. And on top of that, we are now experiencing climate change. Now it's like the time where we achieve or reach the highest emissions of all time, and also interlink with all the societal issues like poverty, social injustice. All of this increasing the risk of disaster. And if I can refer back to the presentation from Dr. Sreeja as well, it reduces or increase the vulnerability and also the exposure to disaster. And that's why I think it's very relevant that more and more researchers, especially in the DRR field, is now campaigning for this no natural disasters. It's very relevant because we keep hearing the word natural disaster over and over again. Seems like we actually blame the nature, but actually we are the one who is causing all of this. And I think I would like to here refer to the report, World Disaster Report in 2020, published by FRC. Like, disaster occur when a community does not have what it needs to withstand with the impact. So of course there's natural hazards, something that out of our ability to influence: storms, heat waves, other extreme weather. But maybe it's also relevant to mention that this development of hazard science is ongoing. There's even a new hazard called societal hazard. So how do you actually think about this human-induced disaster vis-a-vis societal hazard? So it's an ongoing discussion that we always have to have, but of course all with the goal to actually solve societal problems, including the increasing risk of disasters. Right, so we need a transformative change. Maybe most of you already heard the term of tipping points, is where Earth system reached the limit. We see all the signs of reaching the tipping points with frequent droughts, also the thawing of permafrost, all links to the increasing risk of disasters, water-related disasters and other type of disasters. So our role here, of course, as human, we have bad Anthropocene. Well, we actually trying to change the Earth system and degrade the environment, but we can also go to the direction of good Anthropocene. And I think the concept of governance here is very relevant, not only as a solution, but also as a reflection of what we are actually already been doing in reducing the risk of disasters. So if we wanted to transform the society, we need good governance. And it means that we need a good institutional system in place, good structure, good mode, good actors with their leadership, and also network, a good policy, and also measures or strategies actually to implement the policies. And we have to actually think about systemic institutional change, rather than thinking about how we deal with one type of disaster at the same event. But we think about a system change to make sure that we anticipate future risk, and also responding to wicked and complex problems like climate change. You cannot just address the symptom. We have to actually understand what is the root cause. And our challenges in the future is really uncertain. We see with the COVID-19 situation. I think there are already a lot of signs, but we disregard it, and we think that we are in a safe space, but we are not. So I think it's very important then, like refer to Dr. Sreeja's presentation as well, to understand what is the risk now and also in the future. And change our behavior and way of life in order to make sure that we reduce the risk of disasters in the future. And I think Sustainable Development Goals is a very relevant unified goals of global citizen, right? To really make sure that we live sustainably in the future. And of course, there is this technology and innovation that can help us along the way. Thinking about flooding, building dams, dikes, etc. But I think it's very much more important to think about how we as human and the societal system can actually think about behavior change to support this technology and innovation at the first place. Right, so another concept that I wanted to share with you, this is also still in developing in DRR world, also among the researchers, is the concept of systemic risk. Me and colleagues from Indonesia, including Dr. Rahma and other colleagues, are working on this concept, really trying to understand disaster as a result of interrelated events and interconnection between system, natural system, social system, governance system, and to understand what are actually the drivers. If we talk about water related or urban flooding, like what Dr. Sreeja mentioned, Urban development might be a driver, but urban development is also a result of a demand for increasing the wealth of the community, right? So it's not in isolation. So understanding the whole system and how they interact, it's very important if you wanted to think about how to address systemic risk. And of course, this cascading effects that the effects is inherited through generation with long-lasting impacts. And our goal is to increase the capacity to build back better. So whenever we get struck with disaster, we can build back better and make sure that our community is resilient. Right, so we come back to the interactive session again. I think I talk enough. I wanted to pick your brain, not literally, it's just a figure, on one case that is very relevant to what Dr. Sreeja just presented, COVID-19. If you can go back to your phone or your computer, I wanted to ask you if you think that COVID-19 is a type of systemic risk. Yes, one, okay. Right. Everyone say yes now. Maybe, okay, the numbers are ticking up. Yeah, I think it's quite representative. It's more than 50% from the total people who join the club say yes. Now I wanted to challenge you again. It's I'm sorry if it's like maybe you expect that you listen for explanation for me, but instead I flip the classroom now. So what elements make COVID-19 a systemic disaster risk? Yes, it is, but what elements? If you can maybe just type 1 or 2 words why it is a systemic risk. Seems like people are working hard, thinking hard. That means that concept is not very clear for you. I mean, for us, I think for all of us. Okay, human behavior, breakdown of entire system. Very nice. Oh, suddenly there are more input, which is nice. Unprepared, gaps in knowledge, human behavior. Right. Okay, lack of plan and policy. Complexity. These are the indeed a very relevant keywords that coming out. Okay. Well, yes, it is a systemic risk, but I think what is important is to understand what are the systems in place and why, for example, COVID-19 is an example of systemic risk. If we see that it's a result of, like I mentioned before, human encroachment to natural system, unprepared policies and regulations, lack of knowledge about what is the possible risk, biological hazard risk in the future. It's all interlinked. And also how our financial system is actually damaged with COVID-19. It's also a symbol of how systemic the risk of COVID-19 is. So I think this hopefully can trigger our understanding that an event of a disaster is not in isolation. So it's a result of one particular or more elements of the system that broke down. And it actually gives a domino effect, let's say, or path dependency effect that makes the whole system break down. But we're still not sure if this concept of systemic risk is actually helpful for disaster managers. I think this is something that we have to think about more. How in the first place we link all of this relevant system, because reflects also the institution and agencies and policies. For example, with disaster risk and climate change, we see a lot of fragmentation, right, between policies. We don't use the same terminologies. And how can we think already about the system if we in a community doesn't try to reach out to other community that is also relevant with the issue of disaster risk? I mean, like the example of 2018 Sulawesi earthquake and tsunami and liquefaction, for example, is also a result of a system breakdown. We think that the earthquake, of course, that it caused tsunami and that's it, because that's what we usually experience with Indian Ocean tsunami, etc. But then comes liquefaction, and also after that the collapse of the infrastructures, etc. These domino effects we haven't actually think about before, but it's an eye-opening events for us to think about the systemicness of a risk and how in the future we can deal with this. Another example is annual flooding in Jakarta. It's an annual flooding. It happens even maybe 2-3 times in a year. So maybe it's not even, we can say once in a year or annual anymore. But it's also about a lack of urban planning, participatory urban planning process, lack of social equity and justice, poverty, asymmetrical political power, etc. So, and historical elements as well, you know, colonization of the Dutch, for example, how it affects the whole water management system in Jakarta. This is a very, very big homework for researchers. Why? Because we used to work in our own field. I'm a social scientist. I work to understand human behavior, governance system, etc. But I think it's not enough. If we wanted to really go ahead with thinking about the systemicness of a risk, we have to reach out to be more interdisciplinary. I have to also learn to understand how the natural system works, right? And I also have to learn about how the practitioners and the governmental agencies work to be able to solve the problem. There is one framework existing from IRGC in 2018. It's actually called Systemic Risk Governance Framework, where all the elements of governance or management or step-by-step to deal with systemic risks are explained. I will not explain the whole thing. You can also check it yourself with the literature and the report. But what is important here is indeed first to understand, explore the system, and also make sure that we develop scenarios. I mean, scenarios in itself is a tool, but I think it is a very helpful tool to trigger our future thinking. I think there's also activities within Uunspire about future thinking. This is very important. How to determine goals and level of tolerability, and also develop the strategies, thinking about the uncertainties, etc. And we all need to work together on this. So it's not only the work of researchers, of governmental agencies, but all stakeholders need to work with this. Right, so I wanted to, it's just 2 more slides. I wanted to ask you again in the Woo Clap, if you can think about actions or what should be done to govern systemic risks. I put like a very preliminary category here. Maybe they're not making sense or they're very interrelated, but just put whatever you think it's needed actually to govern systemic risks from the individual perspectives, from how you see it as an actor of young professional or young researchers, or the institutions that you work in. Policy and regulations, maybe we need, I don't know, law that can be more facilitating more uncertainty, and this is very difficult because law is supposed to be very strict and supposed to be limiting, let's say. So how should we do this? And also actions. I mean, someone already put open science. I think this is an action, the importance of the open science to be developed further by the researchers and scientists. Upgrading education syllabus. Perhaps you mean that we have to think more about the the interdisciplinarity, maybe. Keep learning, of course. Coordinated process. Coordination is very important. Integrating all disciplines, it comes back again, the interdisciplinary and transdisciplinarity. Science-based policy, very important. So how to make sure that all the policies that are produced are science-informed, including systemic risk and cascading risk and the risk assessment document. This is something that needs further discussion, I guess. So how we can understand the overall, the current system, the policy and governance strategies in place, and to introduce new type of framework, which is a very big homework, I would say, because you have to work together with the governmental agencies, etc. I will keep reading, provide guidance to organizations to improve resilience. That's correct. And also endorsing more research and developing methodology to assess and understand systemic risk. Again, understanding systemic risk then is a priority. Okay. Bottom and top approach is crucial. Maybe bottom up, the combination of bottom up and top down approach, if I'm not mistaken. Indeed, I mean, especially in countries in Asia, we have to start thinking about combining different governance modes. So not only deal with the hierarchical system like we have now, but also trying to embrace more self-type of governance, so community-led initiatives, and supporting that with the national policies or regional policies. Collaborations, integrated modeling is also very important, and develop methodologies that are measurable and can be implemented by different fields, let's say. Okay, thanks so much for your participation. I'm sure that you have a lot more ideas, but I think if I can try to summarize, this is a very abstract thinking, of course, I'm sorry for that, but it's just to trigger our thinking about systemic risk in the future. I think what we need is to be more ready to build future thinking and to incorporate future thinking in our research and also policy and practice. But what is most important is also to learn from the past. So can we see a trend? Can we, yeah, it's not always linear, of course, but it's important to see the historical patterns, to consider path dependency, how they interlink, and also establish network and resources, develop tools and policies like someone already mentioned, integrated assessment, for example, open science to open up access to science, work with the community more, and lastly, act. I mean, we should just do what we can do in our own function. And I think when we think of ourselves as a one piece of a puzzle and then we come together, it will work, I'm sure. So yeah, thank you so much for the time and invitation. I hope that this discussion is useful, and yeah, I look forward to our discussion session. Go back to you, Anne.
Okay, thank you, Dr. Annisa, for a very interactive presentation. I could say this is our first time experiencing this kind of presentation and interacting in one time. So we are moving to our final speaker for today, Mr. Satbek Sarzhanov. I hope I pronounced your name correctly. And he is one of our active members under the Uunspire Central Asia chapter. He was born in the Almaty city of Kazakhstan. He earned his bachelor degree in finance in Almaty Academy of Economy and Statistics and Diploma of Sustainable Development from Baltic University. With his active involvement in various young and science workshops, Mr. Satbek is also currently a chief specialist of scientific, technical, and international project sector, and also a chairman of the Council of Scientists in Institute of Seismology of Kazakhstan. Today, he will be sharing on a topic of a closer look at Almaty tragedy, January 2022. So, Mr. Satbek, the screen is yours.
Yes, thank you so much, Anne, for introducing me. Basically, today we're talking about human disaster, but I think my presentation would be more like a personal observation, because it's always talking about human-induced threat as terrorism that was happening in the last weeks in my city, Almaty city in Kazakhstan, Central Asia. That happened. I think it's the first time that we ever experienced such kind of, I don't know, mass destruction, so much terror. And so I just want to give my overview what was happening and just give a closer look about Almaty tragedy as we call here. So I will try to share my presentation here. Let me try. Tell me if you see it. Can you see my presentation?
Yes. Yes, I can see it.
Yes, thank you. Now I'm going back to the first page. So a closer look, Almaty tragedy. So what started as an economic protest ended up terrorism. The whole protest was just accumulated due to the domestic problems in the country, like pandemics and the increase of prices for the goods, etc. But end up as such a huge, massive destruction and a lot of economic loss. So I will give you some timeline overview what was happening. So protests and riots in Kazakhstan started from 2nd January 2022, and they started in a small city, Janauzen. Janauzen is like very active. They know for a lot of active people who are engaged in such riots, and the people of this Jana Hussein they took to the streets to protest against the jump in prices for liquefied gas. There was a huge jump for double price, like from 50 tenge to the 120, and that make a lot of shock of people. That's why people go into the streets, block the roads, and nearby they go to city administration, mayor office to demand a change in this kind of prices. And even though their officials came to the people, they were talking with people, still the whole mass of people who were not feeling, were upset about the situation, will come in to the bigger number from 100 to thousands, and also not only in one city, they were like spreading in other cities of Kazakhstan. And that's why I'm going back from this time to show how it came to the Almaty city, since Janauzen is in the west of Kazakhstan and Almaty is actually in the east, and there's like 1,500 kilometers so far. It's a huge amount of distance, and in such short time the people just were trying to protest against it in sort of this kind of protests in Almaty that would took, I think, in so from the media, as I know, took from 4th July. For January, it began Gaza near their Alatal theater in Almaty. So, and also in other cities there was going on protest, and what was not expected that most of the protests that were going on, they were peaceful, and in just a nick of time it became such a terrifying, just like movie scenery. And on the night of January 5th, the police fired tear gas to the protesters, stunned the grenades and rubber bullets at the Republic Square in Almaty that were not happening. And most of the time, no, actually not sure what was the reason of such kind of violence toward protesters. Some people said that they've probably been actually the protester who initiated to propagate this kind of actions, and this was kind of defensive scheme, but we don't know. Actually, there's no official statement about that. But since then, their situation started being worse. The police cars were set on fire near the square. On the night of January, our president declared the state of emergency because the situation was just on such a worst. And on the morning of January, as many protesters were demanding the Tokayev, which is our second president and of Kazakhstan, accepted the resignation of government in afternoon. Even though many officials are accepted many demands, and actually try to be more respectful, helping and support the public. It's still there, and there's no decrease in such kind of attitudes, and that's become even more worse. So afternoon in January 3rd, they begin the shootings in Almaty. A group of unknown people broke into their main building of mayor. So you can see on the pictures what was going on. This couple of weeks ago, this is city mayor on the night of January 5th, and there was mass destruction, and this is after. So the building was totally burned down from the inside, and not only the building, but streets were just covered with a lot of debris. There were huge damage to their small and medium-sized businesses. And after that, unfortunately, even though there were huge participation of quite the peaceful protesters, the officials literally declared that this attack was by the terrorist gang. Since then, we cannot just claim them as peaceful protesters. There were actually peaceful protesters among those people who are trying to make a change, but unfortunately, terrorist groups were taken over and used this kind of opportunity to make such a huge destruction in the city and to the government. So since then, this is I just want to show you what was happening. This is inside of the city, and this is what after they trying to this is phase of recovering. It's just a small picture, and this is inside of a sort of small, and this is, if you can see, the consequences. So after the riots in Kazakhstan, there will be like more than 200 people deaths, and most of them actually has happened in Almaty city, and it's about 140 people, including there was a lot of young death. And after seeing that, since why I'm bringing here to their audience, to the people of Uunspire, because since I was myself there, the eyewitness of such event, I more often ask myself the question like why I didn't see this coming, like why I couldn't foresee upcoming terrorist act, because it's literally can be classified as terrorist act. And I wanted to put this information, this situation in the prism of DRR, like how the city is vulnerable, the level of vulnerability to city, the exposure, the anything like that. And what by studying this topic, I came to this kind of material. It's I think everyone probably should know about that, because it's give a lot of clues for the people who are afraid for the future. If there's kind of signs or indicator for upcoming terrorist act or sort of civil unrest. So this is a global terrorism index 2020. Unfortunately, there's no still it didn't issue 2021, and maybe the situation will be more clear. For example, when I was looking for the indicators to Kazakhstan, they were like not what I expect, because I was thinking that the numbers would be quite indicating that there probably some kind of unrest, but no, unfortunately not. But what I find interesting that there's, if you can see sort of correlations between factors, these factors, indicators, I think they can help people just to estimate the probability of such kind of terrorist act or civil unrest in their countries. Because whenever you're just looking at them, for example, not in a qualitative point of view, but in a quantitative, like number of events that happen, for example, related to the religious and ethnic tensions, to corruption, some, and anything like that. So you probably see the signs of upcoming event, and or you will see how you are vulnerable to such kind of terrorist attacks, how you exposed. And here on the next slide, this is the map of Almaty city. Here you can see if this is the main battle how I can say that was happening. This is the city administration, and unfortunately, I was that day I was on duty because of the state of emergency. We have to monitor. We have to be now, and I left in the city, so I was almost near here, so I could hear these grenades, shootings, everything. There was massive. I was just seeing that overall. The and what's happened there. And one of the I was thinking one of the signs that made the city, the civilians, the more exposed, more vulnerable is the urban plans in the past. For example, there was some changes in sort of view of the city when ex-mayor declared war on artificial metal fences because he was thinking that they are making the city look very, not given to the touristic view, and that's why by his program, the many governmental, many just buildings who were on the main streets lost any kind of defense as fences, and that's exposed because there was a lot of looting going on governmental buildings, including my building. Because we were on the duty, there was several cases where we see that some people were going around our building several times, just circulating, and as I find in some kind of reports, materials, studying terrorism, actually it's indication that your building could be targeting, because if some, this terrorist people can just circulate and see monitor the building, because there was a lot of cases when the governmental buildings, institutes were just looted, they were burned, and etc. And except from that, also we should never forget about like societal factors, any kind of events, like what can happen or could happen in the past and indicate your future. For example, there was two events in a city that would probably say how vulnerable people are, just peaceful civilians to do such kind of civil unrest by organized criminal groups. So there was kind of shooting related to the person who are not resident of a country. There was like quite a few deaths, and it was held about 9 hours, 9 hours. So the person locked himself. There was some situation, and he was just shooting at people of the block and etc. Of course, the operation was successful, but this, I think, one of the indications that can tell to the audience if you have if there is such kind of events happen in your city, and how police force quickly solve this problem. Will say how in the future there will be some kind of problem be resulted in a time. And also what I want to bring here, because as an eyewitness, I've seen a lot of young people just joining, doing misinformation, disinformation online, and just attempting this kind of attitudes. I think social media plays a big role on radicalizing young people this time, because what I actually noticed, but unfortunately I couldn't find any evidence that for any TikTok or any other like local social media, there were violence related videos coming up, or videos that were actually demanding, saying that the government or etc. There was just and probably they are not as the people many think that it's just making people be a terrorist, but they making the young people be a kind of human shield or being kind of tool in such kind of criminal hands, because most of the time there isn't, but there is actually, as I told previously, a lot of young deaf. In 225 people, there are maybe 60, 50%, and there is a young people like 19, 20, 25 just that were killed. And this is the reason why, because they maybe were not sure of the actual, messages of such kind of movements, and because they joined because they want to make a change, they became the victims, became the just sort of human shield in the hands of criminals. And I was also trying to find any kind of clue that will, picked up, be give a sign that there is going on some kind of organized criminal act. And in here in the Google Trends, I find, for example, I typed for the buy a gun in Russian, and you can see that on January 5th there has been quite good demand for such kind of search, and I think it also can be a sort of indication of a kind of event. But what was not typical for such kind of situation, as I told you, because it's more was related to terrorist act, that, and why people didn't see this coming, including myself, that in the history, Almaty known for many riots. It's happened several. It's like a tradition. Every year, people going on the street, going on Republic Square, demanding the changes from the government, from officials. And why people didn't see this coming, because as I told you previously, because it's just they became the victims of the situation, became the human shield on the hands of criminal hands. And the consequences of this situation that happened here, I think it's a more economic loss, because a lot of the victims not only were people, there's peaceful civilians, but also businesses. A lot of small, medium-sized businesses. As you can see here, it's about 42 billion tenge of damage. Even though the situation right now stabilized, it's still on sort of, the situation is still on recovering, and it will take several months to get here. So this is my overview. Please, thank you so much for your attention. What for you, moderator, and please continue.
Thank you, Mr. Satbek. Yeah, thank you for a very inspiring and moving presentation. It feels like we are watching a movie, but it's actually really happening at your place. So we pray for your countries, for your place, and please be safe wherever you go. So thank you again to all the speakers for the presentation. We have a very solid sharing session for today, from the COVID-19 experience, the act of governance, and the human protest tragedy in Almaty. So now we are open for the Q&A session from the audience. We have a list of questions already. So I will pick the general questions, which means it's open to all the speakers to answer. So the question is about, what do you think about human-induced disaster and national spatial planning? Anyone can go in first. Maybe Dr. Anisa or Satbek or Dr. Sreeja want to go first?
Yeah, I can share my thoughts on this. Although I'm not a planner, so maybe apologize if it's too general. But I think it's very relevant. I mean, spatial planning itself is a product of human activities and also a part of governance strategies, if I can link it to governance. And I think then failed spatial planning or inappropriate spatial planning will lead to some extent to disasters, either creeping or sudden disasters. I mean, maybe one example later on, perhaps Dr. Rahma is more capable to explain this. For example, in Palu, the area of the liquefaction, for example, is planned for housing and settlement. But we are not, maybe policymaker or planners are not informed or not able to come up to a decision to make that as a place that doesn't supposed to be a settlement or housing. And I think there's a lot of issues when we talk about spatial planning, not only about practical issues, but also political interests, because it links to interests of different actors, right? I mean, industry, for example, and also the trade-off between trying to provide settlement or need of settlement of the community, but also in the same time produce economic benefits to the government and also to the area. So I think this is a type of long-term issues that if it's not resolved, it will lead to some extent disasters in any type of forms, either creeping or sudden disasters. Yeah, so it's peculiar issues. But for example, if we try to incorporate this idea of systemic risk, it's actually a platform to bring people perspectives together in the same table, let's say, to discuss about trade-offs, opportunities, and what would be best for the society. And again, it's not always that policy actually on the side of the society. And this is also political issues in my view. So hope this is useful.
Yes. That was the most expected answers. So, Dr. Sreeja or Mr. Satbek?
Yeah, I agree with Anisa, because this is just especially the planning. What makes the people be victims of disasters, of any kind of stress, is just them being vulnerable. The city, for example, as I mentioned before, the people were just being exposed to such kind of hazards, such kind of threats. And what need to be taking place, that they have to be estimated the vulnerability of people towards any kind of multi-hazard, multi-threat, and just make them less vulnerable, less exposed. And that's all I think about it, because I think Anisa gave a very good answer for such question.
Dr. Sreeja.
Yeah. Your question was regarding the spatial planning, I think. Yes, I can say about my experience because I'm working with the government. So in Kerala, we were in a process of relocating the vulnerable population of the coastal areas, those who are living very proximal to the sea, ocean, especially the most vulnerable people, that is the fishermen community. We were given the option for helping them to relocate to a safer location. They can retain their land which was there near to the sea, but also they have an additional house. If they want, they will be given separate flats or some other, or if they need financial support, they were given financial support to relocate them. That policy was taken by the Kerala government couple of years back, and it's not feasible every time. It's not feasible to relocate people based on their vulnerability, especially for a small state like Kerala. But yes, the government is in the process of doing that, especially for the most vulnerable. Similarly, for landslide-prone areas, we have conducted a study on the landslide-prone locations in Kerala. And based on that study, we were trying to relocate these people to less vulnerable areas compared to the most. They were living in those places which are highly vulnerable to landslides. We were in the process of relocating them. I don't know how much it is possible. Definitely, there are many political and other constraints are there, but still, it is that process we are starting.
Yeah. Okay. Thank you for a very comprehensive answer from the speakers. So, but first of all, I noticed that we have our Miss Titi from UNOCHA in the house. So I would like to call if she can comment in regards to this on this question too. Maybe you can give some comments on how does this human induced disasters in a way how we want to progress with our disaster management or the spatial planning? Maybe you can want to have a comments on that, Ms. Titi.
Hello. Hi. Sorry, I did not open that camera. I do not think I am.
We can't really hear you, Ms. Titi.
Really? Let me try to use my headphones. Okay. Let's try. Okay. Can you? Hello.
Yes. Yes, we can hear you.
Clear?
Right, it's fine.
Okay.
Yeah.
So sorry, I'm not opening my camera. I do not expect that I'm going to be called, but this is a very interesting discussion. So your question is actually, can you repeat again the question? Sorry.
Okay. We are now talking about the human-induced disaster and how does it will affect on the disaster spatial plannings.
Yeah. Well, if we look into the history of disasters, of course, as you mentioned, one of the speakers said it is always caused by the people, by human being. What we try to actually look is that at the initial stage, the awareness has to come from the people, from the community, because I think we have been providing. I think we have been engaging with the government, both at the national and local level, so much, so many years. But if you do not have the people, the community who really understand the needs of really paying attention to disaster risk reduction, then I don't think the investment is going to be fruitful. So as much as possible, we are talking about the national action plan. As much as possible, we are talking about the governance, but making each individual understand that they are responsible for the earth, for their sustainability, sustainable life. I think we have to really advocate on that. I was attending I was attending an event, I think 2 weeks ago, and it relates to the efforts of building the community, building the capacity of the community and also the local government. We do not have any survey or study, but we can see the difference of really making people understand, the community understand, and then compared to the efforts of building the capacity at the local government. So what we need to work is, despite that OCHA works for, of course, coordination, facilitation of coordination during emergency, but making community having the capacity to deal or to think, to work, to do the action on disaster risk reduction is the key. I think that's what I can share. After having been working for OCHA for 17 years, trying to build the capacity, still the key is at the community, at individual people to really understand their responsibility. That's what I can share, contribute to this discussion. Over.
Okay, thank you, Ms. Titi, for the answers. Yes, I couldn't disagree that it must come from the human behavior changes. Then only all the innovations, all the efforts that we plan can be achieved. So I can conclude that way. And then we have another question to the panel. Okay, we have question to Dr. Sreeja. Okay, this is about the COVID-19. Can we consider COVID-19 pandemic as a human-induced disaster?
Okay. Disasters usually we categorize hazards as biological and hydrological, different types of hazards. But even then, we all know how a hazard becomes a disaster. That basic understanding, that is the interaction between vulnerability, hazard, and exposure along with the coping capacity, that transfers into risk. And this risk later transforms, when a hazard happens, this risk later transforms into a disaster. That basic understanding we all have. So without the interaction of human vulnerability and without the interaction of human, not only human, but exposure, we cannot have a hazard transformed into a disaster. So that basic understanding we all have. And coming to COVID pandemic, especially, if we consider what are the prevention methods of COVID, we can say physical distancing, washing the hands repeatedly with soap, sanitizing, then what else is there? Yeah, wearing mask, these things are there. These basic things needs to be there. Then we have to understand what are the constraints which people have, which results in the spread of the disease. So when we analyze that, we can see that all the elements of physical vulnerability, social vulnerability, economic vulnerability, all plays a role in this. That is, people may not be able to afford a 95 mask or any other normal cloth mask for that matter. Physical distancing. When we talk about physical distancing, of course, when we talk about those people who are in urban spaces or who can talk in a very comfortable place, we can talk about physical distancing. But then when we talk about the people who are living in slums or other social spaces where they may not have spaces to quarantine, we can talk about those who are traveling by air. They need to go into separate quarantine in a room without interacting with anyone. It's not possible for many people. So all the elements of vulnerability, we can see, if we try to analyze it, we can see it plays a huge role in the spread of COVID-19. That itself transformed into a human-induced disaster. Not only that, but the secondary impacts of the local, the lockdown and all, that could be, we can consider it as a secondary disaster due to COVID. So I think I answered the question.
When we are talking about the secondary hazard contributed by this COVID-19, we are talking about the impact of the lockdown. So yes. One of the most obvious increasing health issues is the mental issues. So how do you identify the number of mentally impacted person during this COVID-19 in your place?
Okay. Genuinely speaking, I cannot give a number, because that's not possible. To be very frank, we are still not open to talk about the mental illness we face. Even educated people are not. But definitely, we have a system in place that any person who is diagnosed COVID positive, the mental health experts make a call to that person. I was diagnosed last week, like just 1 week back, I was diagnosed with COVID positive, and I got a call from the mental health department asking me whether I am fine, whether I need any other support, and they gave the call to us. But when we analyze, and also we have a separate call center for any people who need any additional support mentally. So we got more than 3 million calls in whole Kerala, and we called back many of these people. That is like follow-up calls were there, but I cannot give a number because that is impossible. Because I think more than 50% of people don't understand that they are suffering from a mental illness and they need the support. So that basic understanding is lacking, even in an educated society. And we are not simply talking about the stress or anxiety. We have to talk beyond that. That is the domestic violence which the women go through during the lockdown. So these things are not at all addressed. They do not come under the category of mental illness. Rather, it would directly go into the police department, and they take care of it as if it is a crime, or it is they take it as a law and order issue. But it also comes under the women, the kind of, not only the physical abuse, but the mental abuse the women go through during the domestic violence. That is not actually addressed. So I cannot generally give an answer for that. But definitely, we have a dashboard in Kerala government where we give the number of calls which we receive, the distress calls, anxiety calls. We have this number in each districts, how many calls we receive, and those numbers are there. But that is not the actual figure you can ask.
Yes, I agree with that, because actually in my country, Malaysia, we also actually doing the same things like what has been practiced in place, where we have hotline or K line for people to call and like talking about their problems during the lockdown and everything. Yeah. So, and I guess it's the same way how they measure or get the numbers of people on having a mental problems, mental issues or something. Okay, then we have the last question to you, Dr. Sreeja. It's about what are the cultural challenges of disaster preparedness in India?
Okay. So India is a big country, so the culture itself is vastly different from south to north, east to west. So I'll give an example. You must have heard about the 2004 tsunami, which happened in many places, but also in India. So there were fishermen with this fisherman community, this women who belongs to fishing community. These women, they are good swimmers, but because they were wearing sari, I hope you know what is a sari. It's a long piece of cloth which women wear in India. Because of that, they were not able to swim properly, and many women died because of that in Tamil Nadu. So, just a cultural context, a simple cultural context, we can understand how even the trained women unable to escape or save themselves from a disaster because of the and also that is one example. I don't want to elaborate on that. So the same thing is happening even for a preparedness meeting. Before me, someone talked about the community involvement. Even when we try to involve the community in many spaces, it was always the men who come together and make the discussions. Never the women get involved in it. They don't have the participation. Even when they are the most impacted ones, usually they are not involved in such trainings or capacity building meetings, nothing. So yeah, so culture has a big impact on, it acts as a hindrance. We can say that it contributes in some way positively, like the traditional knowledge and all is there. Definitely, we all go for that. But there are hindrances due to the cultural beliefs and norms in the society. Yeah.
All right. Thank you for answering, Dr. Sreeja. Okay, next we have questions to Dr. Anisa. There are a question from Kundus in the chat box. There is a new thing happening in the nature, like lakes are disappearing. What do you think about it?
Yes. Wow, it's a very abstract question. Yeah, of course. I mean, that's also the result of mostly human activities, I believe. I mean, one example that I could see now from my research is the Mekong Delta, for example, and Mekong River deltas. Sedimentation is reducing sedimentation is happening in Mekong Delta, and also due to the damming, the efforts of the government and communities to extract electrical energy, for example, but then it affects a lot in terms of sedimentation process, and then it reduced, of course, the water in the lake there. And I think if this trend is happening more and more in the future, where people only think about shortcut of getting energy sources, and it will happen in most of the river deltas around the world. But again, here, what is important is, of course, to understand that this natural places are usually not bounded by administrative boundaries. So if I can relate back to the governance aspect, here is what is important is the collaboration between different jurisdictions. For example, the case of Mekong Delta, of course, the one who is responsible or allegedly responsible is the upstream countries, but they are also having the most power and resources to alter the river, let's say. And then the one who is affected is the lower part countries who have lower resources, etc. So what we need is actually to think more about the nature as a space for making policies rather than thinking about advantage of certain countries. But of course, I mean, it's given, right? I mean, for government, what is important is to protect your own country. But in this case, if we wanted to look into our goal of achieving sustainable development, it will not work. So we have to increase the coordination and also partnership between countries through different platforms, understanding each other's challenges, and how to come up with a solution that not only will benefit the community in certain countries, but also in the whole region and the nature. Maybe some of you have heard about the rights of nature. Now it's also a new, well, it's not new concept, but it's more and more highlighted to make sure that we as human also respect the rights of nature as a being. So I think it's a good, useful philosophical understanding to guide the future policymakers as well. I'm not sure how it works in other countries, but in the Netherlands, for example, where I'm at now, we think about the rights of the river, working around planning to facilitate river or room for the river, for example. I think we have this in Asia as well, maybe not branded as such, but I think this bottom-up perspective of the connection between society and nature can be a very powerful tool for policies and also for advocacy. So maybe that's just some thoughts on that. Hope it is useful.
Thank you, Anisa. Okay, then the last question is for Mr. Satbek. Okay, by looking at your background, having a diploma in sustainable development, so the question will be on how hazard and associated risks are linked with the SDGs.
I'm sorry, could you please repeat the question? I just didn't hear it.
How hazards and associated risks are linked with the SDGs?
I actually don't remember there's the SDGs itself because it's not my topic. Most of them are not my background here. But yeah, there's a lot of things that correlate them, and the office, the people who are working with SDG also correlated with the hazard assessment itself. So I think, yeah, there's a huge correlation between them. Everything is very like interrelated to each other.
All right. Then I guess thank you for all the answers from the for the questions. So we already are running out of time. I guess today's webinars get very high attention from the participants because of the topic is very special and very close to us nowadays on the human-induced disaster. So and now I would like to call Dr. Saran Prakash to give the key takeaways from today's webinar. Dr. Saran, the screen is yours.
Thank you, Anne. Greetings again, everyone. We have had one relatable session, didn't we? Speakers sharing from their pool of wisdom and treasure of real life experiences was what I think made the entire session magnetic, if I can use that word. And our speakers with such rich experience and exposure to various situations truly inspire young professionals like me to do more in the larger shared domain of disaster risk management. So I'll just take a few minutes to very quickly sum up today's session with key takeaways. So in India, Kerala, it's been largely, it has been in limelight for all the right reasons. But, ever since COVID-19 hit, I think Kerala has been on the list of the states which were affected most adversely, most sadly hit, and still trying to cope up. So Dr. Sreeja sharing the case of COVID-19 in Kerala helped us understand what went down in Kerala after all. She rightly began with a factor which forms a generic contributing reason in almost all the disasters, which is the lack of last mile reachability, last mile connectivity. Then, as much as we know the popularly used term planning, the actual implementation of the same still has a long room to go, as she highlighted under the crucial point of inappropriate and inadequate urban planning. From first reported case to declaring COVID-19 as a pandemic, India too, among all other countries, has threaded this difficult journey with the notorious COVID-19. Dr. Sreeja explained to us how the state of Kerala has been walking through vulnerabilities of medical and non-medical kind. Then she wrapped up her presentation shedding light on the role of youth and young professionals in the context of COVID-19 in Kerala, in the form of volunteers and in the professions of NCC and NSS and other varied professions. That helps us recall out loud and clear once again that through some of the harshest times, YYPs or youth and young professionals have stepped up as researchers, as advocates, innovators and communicators in the front line, promoting health and safety. Their courage and relentless determination to help those around them is a reminder of how we can achieve healthier and safer and also an equal world. The real disaster scenario, it actually begins with the triggering of invisible climate tripwires known as tipping points. With that crucial point, we then move to Dr. Anisa Triyanti's very engaging presentation. Thank you for making us all participate in your presentation. Governing disasters, as I understood from Dr. Anisa's presentation, it is not only about responding to the hazard that has struck in, but it demands a balanced interplay of engaging the local populations in humanitarian relief, law, and collaborative decision making with national, international, private sector and community actors in order to understand the dynamics of a globally decentralized yet coordinated process of post-disaster humanitarian assistance. Then we often say that it is never too late. But I think COVID-19 outbreak across several countries in the world in more merciless forms in some than others has brought us very close to admitting that I think this time we are late after all. Because having lost so many lives, livelihoods and financial stability, it took us an entire year of a long chain of unfortunate events to actually even accept that we are in a bad shape. And at this point, and still hopefully, we must understand that COVID-19 outbreak, it finally exposed us to several risks which have been sheltering since a very long time. So as we understand from the sharing of Dr. Anisa, that dealing with systemic risk, it requires not only a detail-oriented plan of action for future, but it also requires the development of a sense of consciousness regarding the risks that are located not very far away from us, but they are a part of the systems that surround us. Then what is difficult than one disaster? I think it's two at a time. That's what Mr. Satbek Sarzhanov shared in his presentation. Actually, his presentation, I think, reminded us all of what we call complex emergency situations. I remember reading somewhere that after the outbreak of COVID-19 in Kazakhstan, the country's WHO's office, it was asked to manage with limited resources and operation capacities. From Mr. Satbek's sharing, it was clear that in the scenario of structural challenges facing an economy, a country, resilience after that situation, it will actually depend on the ability of social safety net to sustain household consumption and the ability and the capacity of digital infrastructure, among several other factors, to respond to the increasing demand. And with that, we concluded today's sessions. I will now request Anne to take over the flow of the remaining event pack. Thank you, Anne.
All right, thank you, Dr. Saran, for the conclusion. We are reaching the end of the session, but before that, I would like to invite the human role model of Uunspire Alliance, Dr. Rahma, to give a closure speech. You are pleased, Dr. Rahma.
Thank you very much, Anne, our moderator. You are amazing moderating today, and I would like to thank you all our speaker, Sreeja, Dr. Anisa, and Satbek, all the attendees, and also all the teams of DRR Talk behind the scene who are working really hard to make today happens. It's really interesting to hear, and Saran has wrapped up very well in the end. All has bring various angle of human induced disaster. We can learn from the perspective of COVID-19, the natural hazard, but especially the human hazard. And we can clearly see that the complexity of human behavior, and there are so many detailed factors building the vulnerability to, and also it's not only one disaster, but it can trigger cascade to another disaster. But it's also the system itself, because sometimes we are not capable yet to think systemic. So maybe we are thinking more sectoral. But it's really today discussion and interaction really open up our mind how this kind of complexity make even people more prone to disaster. And actually this complexity is still rarely addressed in risk assessment document. So it's not in the radar of as a basis to develop any DRR strategies and planning. And then thus it's not anticipated. And here trying to think systemic to anticipate what might happen in near future play important role, such as what Dr. Annisa has also raised in her last slide, to build the future thinking. So in this regard, I would also like to inform that Uunspire Alliance, together with UNESCO, UNDRR, and UNDP, is currently currently conducting a future literacy lab on DRR future thinking since 2021. We have finished 2 labs, the disaster risk governance, future thinking of disaster risk governance, and the future thinking of disaster risk knowledge. And we will start our 3rd lab in early February on the human behavior and hazard. So today's session is very related to what we will discuss in the 3rd lab. While in the lab, we are also using the future triangle, which consists of the pull of the future, but also thinking the push, what is the push of the present, and also not forgetting the weight of the past. And while the lab is limited to 40 people, and we are currently in the selection process, we will have the Let's Talk DRR on human behavior and hazard, which we will discuss on what the young professionals, young people around Asia Pacific is thinking about this human behavior and hazard. The Let's Talk DRR is open to everyone, and it will be held on the March 4th. Please stay tuned in our social media. We are in the Instagram, Twitter, Facebook, LinkedIn, and to continue our webinar. Our next DRR Talk, our DRR Talk is every last Saturday in every month. We hope to continue our dialogue continuously every month. Again, thank you very much, and stay safe, everyone. Especially my praying to Almaty, which is currently in very hard situation. But I think it's not only Almaty, but also maybe our friends in Afghanistan and in some other part of the world. I think that I hope that all our brothers and sisters who are dealing with disaster, any kind of disaster, can soon recover and stay strong, stay safe, and stay healthy. Thank you again very much.
Okay, thank you, Dr. Rama, and thank you again to all the speakers and participants for rooting with us till the end of our 2-hour webinar sessions. Okay, I would like to remind again for all participants to fill up the Google form in the chat box to retrieve your certificates for today's session. Before we leave, I would like to call everyone to switch on your camera for our quick photo session. I hope Kshitij can help to assist on this.
Yeah.
Okay.
For everyone who is stayed up to now, please open your camera and we're going to click a group picture. So ready? I would like to again request everyone to please open up your camera for a group photo. So here we go. 1, 2, 3. Okay, thank you, everyone.
Okay, thank you, everyone. With that, thank you again to all. See with me again in our next Choco Talk in February. Wishing you guys have a fun weekend and stay safe. Adios. Bye.
Thank you.
Thank you.
Thank you.
Uunspire Alliance is a network of youth and young professionals working in science, engineering, technology, and innovation.
Uunspire Alliance provides the platform for youth and young professionals to connect, engage, and learn from other youth and experts in the region.
We are not only at the international conferences or at the laboratories. Uunspire is working together with the local community in the field
to participate in decision making, demonstrating their ability for advocacy, communication and consultation, as well as leveraging advanced technology.
We strongly believe that inclusivity is the integral factor of the DRR. Hence, all our work and projects are people-centric and from the communities on the ground.
We are committed to supporting youth leadership. We are happy to work with the Uunspire Alliance.
Uunspire Alliance bridges the gap between professionals and young specialists and make it possible to exchange knowledge and experience between Asian countries to make them more resilient.
We work with youth and the young professionals from the academe and the industry sectors to build back better in a post-pandemic world.
Uunspire has connected us and bring us together to contribute for disaster risk reduction and climate change by utilizing science, engineering, technology, and innovation.